like I
what
got
a slick intro.
Yeah, look at that guy dancing and giggling away. Folks, welcome to another Thursday Night Live with your boys, the Soaring Prophets. He's still dancing down there. He is just doing his thing. For all of you that are listening on the Spotify, the iTunes world, we're working on video for you. It's a thing. This guy has spent all day trying to get that arranged for you. You folks on YouTube, you get beautiful faces and our lovely guest tonight. So we have Elissa Baldwin. And she is she's the director of National Patient Education at the Leukemia and Lymphoma Society. And we were really blessed to run into her when she was one of the speakers at Healthcare Amplified, an event you profiteers all know. We did a bunch of content for those guys, had great interviews with a really great group of people, everyone that's out there working on the education side of healthcare. And oddly enough, that seems to be an underutilized environment right now. People have so many questions about their health, and they end up on YouTube or they end up Googling, and everyone thinks it's just awful information for the most part. But it's people like Elissa that are trying to change that, and the work that she does every day. So Elissa, thank you so much for joining us. It's a pleasure. Where are you coming from tonight? I know you got an Ireland trip planned. You were saying, where in the world are you this evening?
Yes, I live in Portland, Oregon.
Oh, so you probably got rain like we do this evening. It's probably
it has been raining. It is currently very cloudy.
Yeah, gross. Well, that's for another story. I had to cancel an interview just before you because I had an emergency wet daughter standing out in the middle of the rain for longer than she should have. But that's a story for another day. But again,
I just said it builds character. I thought it was fabulous. She learned a lot by standing in the rain.
Yeah,
I agree.
You
Gen Xers know what it's like to stand in the rain. I'm just saying.
I'm not quite that old.
I'm going to send her your folks' email and contact information, and she can hash out exactly her feelings around what that was like. But anyways, folks, when we had an opportunity to do Healthcare Amplified, our whole purpose and goal was, again, to shed light on these amazing speakers, these amazing people that are doing the education side of the healthcare industry. And they're spreading it through podcasting. They're doing video interviews. They're doing this whole kind of multimedia dynamic that is so important to getting to the front of the line when it comes to advocating for themselves with their professionals. And Miss Baldwin obviously is doing that. Elissa, tell me a little bit about exactly what you folks do at the Leukemia and Lymphoma Society and the little bit kind of the different spin you guys are taking in regards to advocacy and the patient side that a lot of people maybe are missing in their day-to-day interactions with their doctors.
Absolutely. So at the Leukemia and Lymphoma Society, we kind of had a multi-pronged approach to blood cancer. Of course, we have the research side. They are looking into new blood cancer drugs and medications, trying to increase the survival rate. But we also have a health equity side as well. So we're looking at what gaps there are in care, because what's good is research if they can't get to a care and they can't get to quality and affordable care as well. And so that's one prong. We have, just like you mentioned, advocacy. We have the public policy side, and then we have our education and support. And so we have people that blood cancer patients can call into, or their caregivers, and get quality, good, accurate information about their blood cancer. And then we also have people in the field educating, and then our national team, which is what I am on, our national patient education team. And our goal is to educate patients about their disease. Our hope is that we will educate them enough to where they're learning things, whether it is about a new treatment or side effect or something that they can come back and go to their treatment team and say, hey, I just heard about this, or I heard about this clinical trial, or I heard about this drug. Is this something that I could do? And so as a leukemia survivor myself, I understand that it's really important to be educated about your disease. Of course, one thing my doctor said was to do not Google my disease. That was the first thing he said to me. And so it was up to me to not just find random information, but find good quality information that was accurate, so that, again, I could come back to my doctor and, ask him questions, and also feel empowered to advocate for myself. Certainly I know you guys are up in Canada, and certainly in the US, we need to advocate for ourselves in our healthcare system, and be able to, push further if we don't feel like we're getting what we need, whether it is a treatment or your side effects not being taken care of, or even survivorship issues. There's a lot of issues that come after treatment. And so yeah, my job is to educate patients and their caregivers, their loved ones. We don't always say families, because sometimes it's a chosen family, and sometimes patients are going it alone. And the different things that we do a podcast. So the Bloodline with LLS is our patient and caregiver podcast. And then we have actually a professional podcast as well. That is a different team from mine, the professional education side. So they are educating the healthcare professionals,
Right.
so that they know about stuff going on with the patients, and they know what resources the LLS has, so they can tell their patients to come essentially to my department and learn more about their blood cancer. And then we have the 2 podcasts. Then we're also doing patient videos, monthly webinars on various diseases or different treatments, like CAR T-cell therapy is a big one that people want to hear about. I am doing vlogs. So I'm going and traveling to different places around the country and speaking to doctors in person. So not just virtually on the podcast, and also podcasting live from conferences. And that has been a lot of fun. So yeah, that's kind of the gist of our department.
I love it. And so, Elissa, one of the things about the Healthcare Amplified piece is that they were trying to bring professionals in the space together, right?
Mhm.
Clearly, and I was remiss to not mention that you are a survivor yourself. That is, it's the brand that you're representing, but you do it from such a unique place. Because of that, you're not just some marketing agency that is deciding that this is the messaging that we're going to run with. It's a unique story. It's an amazing value proposition that you bring to that organization. And again, thank you for what you do. It really is wonderful that you're able to do that. But when you're traveling around and you're dealing with these professionals and you say, hey, we're doing a podcast in the healthcare space, what are doctors? What are their opinions of that right off the hop? Are they receptive to podcasting as a format? Are they, that's below me? What is your reaction to that? How are they, taking what you folks are doing on in the education space? How are you being received?
I think in general, from my experience, we've had very good relationships with doctors. I think LLS has been building relationships with doctors and healthcare professionals for a really long time. So generally, when we ask, most of them are completely on board. As long as they have time to do it, they're like, yes. And they want to educate people as well. And they want to tell people about the new patients. It looks good for them personally and professionally. It looks good for their institution to go and participate with LLS and show that they are, really working to help patients. And so in general, I haven't had any issues. They've been very receptive, and a lot have shared. We just did a podcast a few weeks ago on myelofibrosis, which is a very, very rare blood cancer. And so, yeah, right. How has nobody heard of it?
Yeah.
And the doctor we did was at MD Anderson in Houston, which is one of the major cancer centers in the US. And he was so excited. He's very active on X Twitter, and he's also very active in the myelofibrosis space. And so he was so happy to share it. He's like, send me all the things, send me a social graphic. I'm happy to share it with my patients, and then other doctors. And so it's really good to kind of bring everybody together. And so far, doctors have really enjoyed doing it, and we try to make it as easy as possible. We let them know, this isn't a presentation. Right. This is a friendly conversation. We're going to let you know the topics that we'll be covering, but otherwise, it's just a friendly conversation. You're coming up and chatting with us, and we will guide you through with questions. And so in general, they've been very, very receptive, which is great.
Yeah,
I think that's brilliant. So I was listening to a podcast today, and it was about this woman who is a doctor, and she deals with chronic pain. And she said that the podcast world has helped her out so much in the areas of knowledge, because she doesn't have enough time to talk to each patient and, really answer every question fully, because there are so many patients to deal with, that she can send them to this link, and basically any question they have can be answered in a real way, not like, you know, when you just Google it and then you find out that you have 18 different things. You actually know exactly what it is and you can be directed. And I think it's fabulous. And I could see every doctor wanting to do that. So in what you're doing, you had a unique experience where, unfortunately, and I'm very sorry that you went through it. Now, I always like to know the journey of a person. And I was wondering, so before you had leukemia, what were you doing? And how did you go from there to here? Like, were you already doing it, or was it something else? And it just, I don't know, God said, hey, you know what, Elissa, you would be better served to be in this space.
Yeah, I had a crazy journey to get here. I actually did sports medicine. So I was a certified athletic trainer. So I was the person that runs out on the field and deals with all the injuries of the athletes. I had been doing that. There was a high school program.
Wait, do you have the magical cold spray that they use on soccer players?
The magical, I don't know about that, but I would say that we had a lot of magic to help them out. But yeah, so I had done that since I was really 15 because there was a high school program, and then I loved it so much that I went on to get my bachelor's degree, then master's degree. And when I got sick, I had just finished up the year at a D3 university here in Oregon, and the way that my leukemia is, you basically can't work for 9 months to a year plus. And so they told me, you're not going to go back to work for quite a while. And because you have no immune system and basically a lot of times no blood cells. Period. So after chemo, your bone marrow is completely wiped. So you don't have red blood cells, which give you energy. You certainly don't have white blood cells that keep you from getting infected. So a lot of times was, back and forth between the hospital and home, and staying home for quite a while. And so I wasn't working. And I think I had decided at that point that I just didn't want to go back. I think I'd been checking out for probably the last year of it, which is crazy that I got pushed out essentially with cancer. And then I started looking at other things. I'd been really interested in event planning, and so I was on the board of another nonprofit at the time, and a woman on the board with me was a corporate event planner. So she did benefits fairs and things around the country. And so I told her I was interested, and she ended up hiring me while I was still in treatment. And, she was like, listen, we'll just work you up as you're comfortable, just give you, a few hours here and there, and then kind of work up to regular hours, and then work up to full time when you're ready and when your treatment clears you. And so I ended up working there full time then after I was done with treatment. And about a year after I finished treatment, I started feeling like I was missing my calling. And it was such a strange feeling. And I had been pushing it away for, I think, a really long time. And so I finally called one of our local outreach person. And I said, listen, I feel like I need to do something with this. I would like to look into maybe patient navigation or something like that. And she said, that type of position, we generally only have volunteer, but I could get you started as a volunteer and just, we'll just kind of see how it goes. So I signed up to be a volunteer, and 1 week after I finished my training, a position for LLS came up in our Light the Night. It was fundraising with our Light the Night walk, where they carry lanterns, and it's a super meaningful community event. Yeah. And so I ended up being hired in April of 2018. So I was a year and a half out of treatment, and I stayed with that until November of 2020. I always knew that I really wanted to go to the mission side, and our mission side is in general our national side. And I ended up getting hired on the education department, which is just so amazing. It's everything that I want. And I really feel like I'm having a direct impact on patients. Because my personal goal as a leukemia survivor is to make the cancer experience easier for everybody who comes behind me.
Well, so Elissa, tell me a little bit, and you vaguely touched on it there before, but what is leukemia? What is lymphoma? Like these, those out there, that it's a blood cancer perhaps, but like some of the technical jargon, maybe we don't have to dive deep into, but as a survivor, you've probably told your story a number of times and people are like, I don't know what that is.
Yeah. So I had acute myeloid leukemia. So that is, they're all blood cancers. And so that is essentially where, when you have your cells are growing from nothing, right? They're called stem cells, which I think we've all heard at this point, and they end up just not maturing into regular cells. And what happens is they keep building and building, and they're pushing out your normal cells. So all the cells you need, your red blood cells, your white blood cells, your platelets, and to the point where your bone marrow cannot produce blood cells anymore, and that's a problem. So most people end up getting diagnosed when they cut themselves and they can't clot. And I had a friend who had AML, and she cut herself shaving, and she had to have a tourniquet and then go into the hospital. So because her platelets were essentially gone, and then or some people may not heal from infection. Mine strangely came out as like IBS symptoms, and so I was very bloated all the time. And so I finally went into a gastroenterologist, and I'm like, I don't understand why I'm so bloated, and I'm also gaining weight like crazy. And at the time I was training for a triathlon, so I was eating very well, and I'm like, this doesn't make sense. And so they can all present in different ways. Those little immature cells are called blasts, and so I was diagnosed just at the threshold for being considered leukemia, and AML. And my type of leukemia has currently a 29 or 30% survival rate overall.
Wow.
So
hang on a second.
Wow.
You're diagnosed, and the doctor walks in and says,
sorry,
29%. Right, 29% is your potential survivor, or you go to Google, right? Because
so that's why you told me not to Google it.
Right. So that's the unfortunate part about it is that you went home and Googled it, I'm sure, immediately.
I actually didn't. I actually didn't find out. I was really good. My doctor, thankfully, when I got diagnosed, he sent me, because actually I was diagnosed over email. So my doctor sent me a link to some information about AML. Yeah. So I had.
You're gonna want to check out this link.
Wow.
We'll be back, and I'm gonna here in Canada, we'd get you in 8 months, maybe. So that is wild. Email.
Wow. It was actually very, very quick. And so my first gastroenterologist appointment was in March of 2016, and they took a blood test, and it came back that my white blood cells were low. Then they said, go back to your primary doctor and get blood tests. And my white blood cells were not coming up, because if I was sick or something, they should replenish themselves. And so they didn't. And so he sent me off to a hematologist. By that time, that was early May, I think, when I went to go see him. He did a very extensive test, and I was heading off to Europe on a solo trip. I like going to Europe. Obviously, I'm going to Ireland. And so I was headed off on a trip. And so he had said, when he did that extensive test, that, we're going to set up a bone marrow biopsy on the calendar just tentatively for when you get back from your trip. And, we'll just see how this test goes. He calls me when the test results came in and said, we need to do the biopsy now. And so I was like, okay, so that just got moved up by 4 weeks. So there's a problem. And so did the biopsy. He said, you either have leukemia or an autoimmune disorder called Sjogren's. And I pretty much knew at that point I had leukemia, because I was looking at the symptoms of Sjogren's, and I'm like, that doesn't make sense. No. And so I
did Google it.
I was still going to go off to Europe. And it was kind of like COVID protocol, because he was like, okay, I need you to take hand sanitizer. I need you to wipe down everything that you touch. Here's some antibiotics just in case. And then take a piece of paper that with your blood test results. He's like, even if they can't read English, they can read numbers. So if you end up in the emergency room, they'll figure it out. And I'm like, okay. So I still went, and he was like, I'll I'll let you know when test results come back. And so I told him, email me. Back then I was going Wi-Fi to Wi-Fi, so I didn't have cell service. And so I was like, if you need me to call you, just email me and I will call you on Skype. And so I woke up in a Lisbon hostel. I was flying to Norway that night, and I got an email from my doctor saying you have leukemia and you need to come home. And so I still went to Norway that night, and I found a flight a few days later to get home, and I started treatment a couple days after that. So
you were told over email, even before that, before you're leaving, your doctor was so concerned that you're wearing masks and hand sanitizer and stuff like that. Mm-hmm. What would compel you to hop on that plane when you know that there's a good chance that you have a disease that has a 29% life rate? Like, what possessed you? Like, what were you thinking? Like, where did you go? Like, I could not imagine being faced with something that severe and still go on a trip. So I just kind of, if you don't mind,
mm-hmm.
Where did that thought process go?
So there's a lot of different kinds of leukemia. So at the time, they didn't even know that I had AML in particular. So there's chronic ones. There's ones that that don't need treatment right away. And so he couldn't really tell me what kind of leukemia I might have. And frankly, when I heard the word leukemia, like, I thought it was a child's disease, and I didn't even know that it was cancer. So I had a lot of learning to do with that. And then to the reason why I went, because I'm just stubborn. And so I was like, it will be okay. And, I was fully prepared. I did not think that, because when I went to get the biopsy, they were like, oh yeah, like, it will, you should be fine. Go on your trip and you can get results when you get back. So I thought I was going to fully be able to go on my trip. Even when I found out, I emailed the doctor back, my poor doctor. And, I said, hey, I'm going home in like 8 days. Like, can I just stay? Oh. And he was like, no, you can't.
Emphatically.
And so, he's like, I can't tell you how bad your immune system is right now. Cause by that time I had, my white blood cells were so low that, I could get infected with about anything at any time. And so he's like, I just need you here in the States. Like, just get into the United States, because I can't have something happening to you and then you not be able to get home. And so that,
That's incredible. Like, so I have never been on a plane where I've been coming home sick. So it is amazing that you were able to do that. So you mentioned that you didn't even know what leukemia was, which Pat and I know very little about, except what we've looked up, back then when you were diagnosed. What was it like trying to find information versus what you've done to change now? Like, how much more information is out there? Like, what is the big difference from when you were diagnosed to someone diagnosed today?
Mm-hmm. Yeah, I would say because I came in as a healthcare professional, I was very one to ask a lot of questions. And at the time, I didn't really know about LLS. I think that my doctor had, the treatment team had stuck, a little flyer in the middle of this 2-inch packet that I got. And I remember I told my dad when he came in, I was like, just get a folder, please. And I don't have the capability of looking at any of that. So I didn't really know. And so I kind of felt like I just had to ask questions and learn on my own, and learn with the link that the doctor shared with me. And my doctor was very good that he explained to me what the disease was. When I went to go see him, and because I'd switched doctors, so I got diagnosed by a hematologist oncologist, and then I got sent to a specialist at a major research hospital in Portland. And so I had a new doctor, and so he was happy to explain, what this all was. At the time, I didn't really know what the survival rate was. Now, my survival rate personally was a little bit different because I was younger. I was 34 when I was diagnosed. And also, I had the prognosis depends on your gene mutation. So strangely enough, that I did learn through my work at LLS that genes mutate throughout your life just spontaneously. And there's some things that can cause it, like they think that leukemia may be caused by chemical exposure like benzene or by radiation. I lived kind of near the Hanford Nuclear Reservation, about 50, 60 miles away. So my doctor was concerned about that. My dad spent his career out there, so he was not too pleased that was being blamed on radiation. I actually looked at the incident rates in my area, and they were no different than anywhere else in the state. And so I kind of figured it probably wasn't that. And it was probably just spontaneous gene mutation. So my gene mutation, they rate them on highly favorable, intermediate, and then low favorability. So highly favorable, which is the gene mutation that I had, responds very well to chemo, which is great. And then some like intermediate, they might respond, they might not. So they're going to see how they respond, and then they might get a stem cell transplant. And low favorability, they're very likely going to need a stem cell transplant, which is getting donor cells from somebody. And so they they go, that's what Be the Match is, the National Bone Marrow Donor Program. And so people can sign up and be a match for somebody, and they donate their stem cells, which is just essentially almost getting a blood draw, a very extensive blood draw. And those are put in, so you essentially get a brand new immune system with a stem cell transplant. And there's a lot of different AMLs, almost like 15 or 16 different diseases when you break it down into gene mutations. And so all of them have different prognoses. They have different treatments. At the time when I was diagnosed, it was still almost a one-size-fits-all treatment. It was either chemo or you move towards transplant. And in 2017, since 2017, there's been an explosion of new treatments and new drugs, which has been really exciting for a disease like this. But yeah, it's not lost on me that that I lucked out in some way, that I had a good gene mutation of a really bad disease, and that I was able to survive it. And so I think that drives me a lot at LLS,
right.
To again continually push for research, and then also do what I can to help patients get through it.
Absolutely. So you did bring up, the gene aspect of it, and you were saying that since 2017, there's been lots of advancements. Have you heard of CRISPR therapeutics, CRISPR technology, gene editing solutions? Yeah. Are they bringing that into the blood cancer realm yet, or is that in other things? I'm
not sure about that yet, but there have been a lot of advances for, like I mentioned, CAR T cell therapy. And that is essentially, we've all heard of T cells, right? That's essentially when they take out a patient's T cells and they modify them so that they almost give them instructions so that they go in and they're looking for the cancer cell and only the cancer cell. So whereas chemo wipes out everything, CAR T cell therapy will go in and look for a specific target on a cell and say, oh, that's the one. I'm going to only destroy that cell. And the T cell comes in and kills it. Yeah. And so that's been really exciting. It sadly does not work for my type of leukemia yet. But, there's been a lot of advances like that in the immunotherapy space where they're using your own body to kill the cancer cells.
Amazing. Mm-hmm. So you end up in this situation, you're diagnosed, you find yourself looking for something more to do. You volunteer with the organization, and now here you are doing amazing things within it. What does that journey look like once you're inside an organization? And one of the reasons why I ask is that there's so many people, especially when they first start in a career path or going down that line, is that, volunteering is beneath me. I'm X, Y, and Z. I want to do this, right? So you decided to jump in. Maybe it was a capacity issue at first, but that that led a trajectory to something that's really, truly amazing and helping people throughout the world. Maybe shed some light on that.
Yeah, I think for me, it was always that I really wanted to do this full time. So not just volunteer. When I tell you, we have some amazing volunteers. They're just incredible that come in, and that's all they want to do. They just want to help out in whatever spare time that they have. We have a volunteer on my team that just does data entry for us, and she is a CLL survivor, a chronic lymphocytic leukemia survivor, and she is happy to do it. I think she's retired because she travels a lot, and she just does data entry for us. And so some people want to use that as a stepping stone to get into the organization and get to know people in the organization. And then some use it, they just want to do it, when they can and help when they can. And for me, I was really motivated. I really felt like this is where I was supposed to be. And again, it's all because I feel really lucky to have survived this, and I felt like I needed to do something to make a difference, and to make all of this worth it.
I think it's so amazing when someone takes a tragedy in their own life and they use it to lift up others, and that's exactly what you're doing. Unveiling the story of champions is what we're doing today. I think it's amazing. I just kind of want to go back a little bit. You said when I was diagnosed, I thought leukemia was a child's disease. And that's something I've heard a lot. Mm-hmm. So you talk about your podcast and you talk about educating people who have leukemia. How does that happen when you're dealing with children, with children's families? What does that look like? And how are you doing that kind of education?
Yes. So far on the podcast, we've mostly done, work with adults and survivorship, but we do have what's called at LLS. It's fairly new, maybe in the past 3 years, called our Dare to Dream program. And that is essentially really focusing on pediatric leukemias, because generally children generally don't get lymphoma. So it's generally leukemia. Actually, ALL, which is acute lymphoblastic leukemia, is the most common childhood cancer. And so I think it affects around 40% it's about 40% of all childhood cancers. And so we knew that going in, and ALL as a child generally has a fairly high survival rate, but it also can come with a lot of late effects. So we're finding out now those treatments, are affecting those kids that had them 30, 40 years later, and they're having health issues. And so we really want to make sure that we're coming up with, better treatments that are less toxic. And then AML, my type of leukemia in children, has, I think, about a 65% survival rate right now, which is fairly low on still the survivability scale. And you don't want it that low for children, right? No. They need to live their lives. And so again, what we're doing is trying to develop targeted therapies. So we actually have a worldwide clinical trial. So there is Canada's participating, Australia, the UK, Japan, I think several other countries. And they need to do this because right now we're focusing on relapsed children with leukemia. And so because those are the ones, once they relapse, it's really hard to pull them back into remission. And so because, there's still not that many children with cancer compared to adults. And then when you add relapse on top of that as another criteria, there's even less. And so we really needed this worldwide clinical trial and getting everybody on board so that they could pull in more and more people so that we could, our first step was to do screening to actually look at their blood and try to find targets. And then once we have that, to really start looking for targeted treatments. And so that we can provide more, I think our goal at LLS in a big way is to provide more individualized treatment. So we can look at somebody and say, you're not going to get the one size fits all treatment that, may work for this person, but it doesn't work for this person. We're going to look at your factors. We're going to look at your blood. We're going to look for certain targets in there, and we're going to provide you specialized treatment that will help you individually. And so so our children's initiative, our Dare to Dream program is very, very important. We're excited to have, you know, just kind of gotten started on trials. And so we did our screening. We've been doing our screening program for the past couple of years, I believe. And you know, now they're really trying to develop those targeted treatments for these kids, and hopefully, again, not only increase survival rates, but also, you know, again, make it less toxic treatment. So when these kids are 30, 40, 50 years old, they're not having terrible health problems, and they're also not putting themselves at a greater risk for another cancer.
Yeah, can you tell me a little bit more about that? Again, I have a family member who was a leukemia survivor when he was a young man, and now is going through probably a life-ending journey through cancer right now, and not lymphoma or leukemia, but what sort of treatments were occurring, you know, 30, 40 years ago that are now having, you know, potentially life-threatening impacts now? Can you speak a little bit about that?
Yeah, I mean, for the most part, it was essentially, you know, chemotherapy, and chemotherapy is tough. It's a really hard treatment, but in general, that is the, you know, only way to survive in some cases. And it does, you know, it does help a lot of people, but it can cause issues later down the line. And, you know, of course, when we first started chemotherapy, we really didn't know, you know, what the issues would be for patients in 20, 30 years. And when they start really any treatment, you don't know. So you have to try to keep up with patients. They do, sometimes there's been long-term studies. And so, you know, so unfortunately that's what we're dealing with. And I can say firsthand that chemotherapy is not fun, but it saved me at the end of the day. I mean, I'm considered cured now. I've been cancer-free for 7.5 years. Thank you.
Amazing.
And you know, and it cured me. So I you know, there wasn't another a better treatment for me than that. And
And
so,
I can only imagine what it would be like to be sitting there getting that information, and you're like, okay, we're going to pump you full of these chemicals that potentially could risk your life later. And
mhm.
it's like, but I make it through today and tomorrow and the next year, maybe. Those are really tough decisions. And I think it's fantastic what your organization is doing about the
Mhm.
advocacy, getting that information out there. But I could only imagine as a parent what that conversation looks like, right? When your
Yeah.
child is diagnosed, that bundle of joy that you've put all your hopes and loves and dreams. I can only imagine what your parents went through,
Oh,
right?
yeah.
I
Yeah.
wouldn't wish that on anybody. That's amazing. But it's when we have these groups of people that are now 50, 60, 70 years old and they've gone through these treatments, what does that look like now? Like, what does your next 30 years potentially look like? Are you in this new set of treatments? Are you in the previous set of treatments? What is your hope for moving forward in that
Mhm.
aspect?
I mean, the benefit again is to find these targeted treatments so that hopefully, you know, maybe 20 years down the line, we're going to see chemotherapy as barbaric, right? I think that is the hope for everybody, is that, you know, we can move on from that. I mean, there's a lot of new medications coming out that are oral pills, which are instead of, you know, infused chemotherapy, which patients can seem to tolerate better. There's, you know, again, those targeted treatments to where they're not utilizing chemotherapy, hopefully, eventually in the future, where that wipes out everything, and they can just target the cancer cell, kill the cancer cell, and move forward with the minimal side effects. I think that is really our goal there. For me personally, you know, I'm very well aware that I'm at risk. You know, I'm at greater risk than the normal population to get cancer in the future. I'm at greater risk than the normal population probably to get COVID or other, you know, diseases and not do well. And so you know, I think that was a risk. That was a risk to take. It was a risk that certainly outweighed the benefit, the cons. You know, it was that dying of AML would be a absolutely miserable death. It would not be a bucket list right off into the sunset. kind of passing. And so, that is definitely not how I wanted to go, certainly not in my 30s. And so I was willing to do whatever my doctor told me to do. And I trusted that my doctors use evidence-based medicine, which was the most important thing for me. And that's what that's what they continue to do. Is we talk to so many doctors on the podcast, and they are tirelessly working to get these new treatments out. If we look at CML, which is chronic myeloid leukemia, what in the 90s, it had, I think, it had a really huge death rate. So a very, very low survival rate. Most people would live, 3 to 5 years sometimes after a cancer diagnosis. And they developed, actually, a doctor at my treatment hospital at OHSU in Portland developed a drug called Gleevec, which was incredible. And LLS supported the, funding it. And it allowed CML patients to take a pill for the rest of their life, a daily pill for the rest of their lives. And they are living long, full lives. And it's just incredible to see work like that. And what that did, that was a targeted treatment that went after a particular target with CML and to kill the cancer cells, but let them again live full, normal lives, which is amazing. And I think that that's really what we want, whether it is something that they have to take for, the rest of their life, or if it is something that they, can take for a short time and then get into complete remission and stay there. And, research takes time because we got to see if patients can stay in remission for, 10, 15, 20 years down the line with these new treatments. But, it is a really exciting time, and the doctors are, again, working tirelessly. You can tell they are so passionate about curing this, or at least at a very minimum, making it manageable. And so quality of life tends to be very, very high on the priority list for doctors. And even when you're going through a treatment like mine and going through chemo, they still want you to have a good quality of life at all costs. I mean, they will, what's your side effect? We'll give you medication for it to try to get rid of it. My doctors told me we don't want you to vomit. You let us know if you feel like you have to. We'll give you more medication to prevent that. We don't want you to be miserable. And I think that is a little different too than, how it used to be, where it was, you'd lose tons of weight and, be just absolutely miserable. And I feel like treatment teams now are really, really trying hard to get patients through as easy as possible.
Well, we're super fortunate to have organizations like what you folks are doing. And in Canada, we get the side effect benefits of it. Canada, I don't believe in our healthcare system. James and I argue about it frequently. Our system is very different. We aren't on necessarily the cutting edge of all the research aspects in the same way that a lot of the American institutions are, unfortunately. James will be like, it's great. I tend to disagree slightly on our healthcare, but we'll leave the politics aside for today. But it's amazing when you have an organization like yours that's championing the idea of better research, better development, and working forward from there. So are you folks, do you take donations? Where are you getting your funding from? How is that working?
Absolutely. We definitely take donations from the general public. We take them from corporations. Pharmaceutical companies fund a lot of our programs, a lot of my department's programs, which is great. We're happy to have them support us, because I think we wouldn't be able to do what we do as much as people worry about, pharmaceutical companies. They really help support us and support making sure that we are giving the patients all this information, and we still present it. Even if they support us, we always present it in an unbiased way. We're not commercials. And so our priority is the patients. And so, yeah, people can, a lot of people can donate. We have a lot of different events. Our Light the Night Walk, like I mentioned, is our biggest community event. I'll tell you what, it's the coolest event. I absolutely love it. And I still get chills when I think about about it, even though I've been to, I think, 7 now. And we have these lanterns. Actually, I've got my little vase here with our lanterns. So we have the white one for patients, red for supporters, and gold for people that have lost somebody. And so we have what's called, during the ceremony, we have what's called a survivor circle. And so the survivors will come in with their white lanterns, and they'll light them up, raise them high, and then there's a beam right in the middle. It's called the beam of hope. And so it's this huge, like spotlight, and right in the middle, and they're playing this emotional music. You're looking around and seeing, just being surrounded by your people. These are people that know what you've gone through, and they've gone through the same thing. And then they tell everybody with their gold and red lanterns to light them up and raise them high. And so you're just surrounded by this sea of supporters, and you can look out, and usually my family is standing nearby where I can see them. And it's just such an incredible moment. And so that's one of our larger fundraising events of the year. We always do that in the fall because it has to happen in the dark, and we don't need events starting at 11 p.m. And so we do that. Our local Portland one is in October, and it's so much fun. Then we have ones where we have Visionaries of the Year, where people will create teams and compete to be the Visionary of the Year, to be the top fundraiser with their team. And they finish up with this beautiful gala. And there's so many events. We have Big Climb. We have Team in Training, which is the athletics people. So they'll go and do the marathons and triathlons and biking events. We have a huge 100-mile biking event in Tahoe every year, called America's Most Beautiful Bike Ride. And so a lot of people get involved that way when they want to donate, and they either donate to somebody, participating in the event, or they join the event themselves, and they get their families and friends on board. And, I do it every year. I raise money every year. My parents are my biggest supporters with that. And so, it's wonderful to raise money. And
that's just an amazing event. It does so many things. One, it raises money for you, but also it's community. All those events are about building community and gathering people around you, probably at the worst time of your life. But that kind of support and knowing that they're there beside you, trying to help raise money is amazing, which kind of leads me into my next question. Pat always bashes the Canadian system, but in the event that someone who's impoverished gets sick, there's a path for that. We had the fortunate, we were talking to Mrs. American, Christy, who you met also at Healthcare Amplified. Mm-hmm. And she was talking about how she was lobbying for impoverished people to have better access to post-cancer care after the diagnosis, because she was saying they would get diagnosis and then they would go home and they'd go, well, I guess I'm dying, because she said it was like $40,000 or something.
Oh, it's a lot more than that.
Yeah. So for each treatment is what it was. And she had to do several treatments. Are you doing any work in that area? Does it affect LS? And what are you guys doing in that area?
Absolutely. So we have financial aid programs. And so one of our biggest programs that we have is our copay assistance program. So that can fund not only people's copays for medications, but also, so they're given a set dollar amount for the year. And it can also pay for lab tests, any out-of-pocket expenses where they would go to, medical facility. And so that's our biggest one. They are in silos, so that the diagnoses open and close based on how much funding is in each. But we encourage patients to go there. But we also have our travel assistance. And so that will be a $500 grant that patients can use. Sometimes patients don't live near a major hospital. They don't live near their specialist. And so they have to go and travel, stay the night, drive up there. So I'm from a more rural area in Eastern Washington, and everybody that I knew that had cancer had to go to Portland or Seattle, which is 3.5-4 hour drive for each of those cities. And that's where the major cancer center was and where their specialists were. And so, the travel assistance can really help with that. And again, those are, most of them now are regional based. So whatever region that you're in, you can connect with them, see if there's funding available with the travel assistance. And then we have our patient aid, which is $100 grant, just kind of helping for anything that, and they can, I think they can apply for it every 6 months or a year, and they can, get a little bit of help. In another thing, we just actually did a health equity podcast today. We recorded that, and so really discussing the gaps in care. And so that's one of our research efforts, is to look into the gaps of care and find out where we can help with LLS, and then also where we can push for public policy, because we have full-time advocates that are going to Capitol Hill in Washington, D.C. They are going to their state representatives and Congress, and trying to get these bills passed that would help patients. And so finding out this information and what patients need is really important to us, so that we can find ways to help them get through it. And, if we can help them find other resources as well. Most of our information on on our podcast, we have links. They're also telling people if there's other resource available. We just mentioned in a finances podcast, financial aid, just last week, that we just put out, that we mentioned American Cancer Society and the Road to Recovery, which is a transportation help. So volunteers will help drive you to your appointments. And so sometimes, we don't have to reinvent the wheel. We can have partnerships with other organizations and really make sure that the patients are getting taken care of.
It's a wildly impressive system you folks have put into place, being that advocate, being that educational, olive branch, if you will, for a very devastating time in somebody's life where they can go kind of a one-stop shop. But Elissa, how do people get in touch with your organization? How do they get in touch with you? How do they support? Because I think there might be something rolling along the bottom there where you can click on and maybe donate to some causes here. But how do they get, how best do they want to get to work with you folks?
The best thing to do is to go to our website. That's lls.org. That has all the information. There's a section for patients and caregivers. Our website is going to be kind of looking a little bit different pretty soon here, but it still will be easy to navigate. So patients and caregivers, or there's a section for healthcare professionals. You can look and see what the research is. The podcast, you can go below, or you can just go to thebloodline.org. And so that's an easy way to look at the podcast. If you're not a blood cancer patient or caregiver, or know somebody if you just know somebody with a general cancer, we're doing a lot of episodes, and we have a lot in our archive that are general information. So we talk about cancer fatigue, and we talk about general survivorship issues as well. And we just had a podcast last summer that talked about the new Medicare changes that really is important for our 65 and older crowd, and then also those with more chronic disabilities that are on Medicare and qualify for that. And so we try to still put in those episodes that are general enough for everybody. I've told all my parents' friends about the Medicare podcast, because I'm like, this is good information that you need to know too if you ever need to be on medication. It's good information. And but yeah, lls.org, or they can dial our information specialist. I say this so many times on the podcast, so I know this number by heart. But it's 1-800-955-4572. These are oncology nurses and social workers that they're so knowledgeable about their disease. Caregivers can call in as well. And we just have so many resources available. And so, yeah, those are the different ways that you can get in touch with us. And if you want to see more on my department, under the patients and caregivers, you can see our education videos. The podcast will be there, and you can see our monthly webinars that we do, our programs. So, lot of great things. And we do nutrition consults as well. And so they can get a 30-minute nutrition consult for any cancer. And So I'm sure I hope that my nutrition team will love me doing a little plug for them there. But yeah, so we really try to cover the whole gamut of patient care and survivorship in particular, that that they can have all the resources that they need, and we're always listening to patients as well. We want to find out what they need so that we can put programs together and make sure that we are covering that.
It's wild what you're doing. It's wild what your organization is doing, and I thank you guys so much. Elissa Baldwin, LLS, from me, you're changing the world. You guys are doing you're doing God's work. Really, you're touching people's lives in their hardest and most treacherous experiences of their life. And if only you were doing more, like you list off, bang, 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 bang. You got 1,000 things going on. It's a beautiful thing you're doing. I'm proud of you. I'm excited to see what you folks do next. And after working with you down at Healthcare Amplified, having you on here again, we got to know you a little bit down there. You are a beautiful soul for what you do.
Oh, thank you.
Thank you very much for doing it. From me, folks, I want to thank you all. It's always a pleasure, and let's make some money together, guys. Thank you, Elissa.
Thank you.
Yeah, Elissa, it is just amazing what you and your organization do. To think that you went through such tragedy and have lifted up so high, and now you're lifting up others, it is incredible. And the fact that you're treating a whole person, not for quantity of life, quality of life, which is the most important thing for everybody. Because there's lots of people that don't have a quality of life, they have a quantity. And I think it's beautiful what you're doing, that you got the mind, the body, the soul, everything encompassed in your organization, and you guys are trying to help out. You're trying to help out younger people, older people. You're trying to help out impoverished people, and the list just goes on. And to think it all started at the worst moment of your life, and now here you are, not only like one of the more knowledgeable people I've ever met, but also out there talking on a podcast to intelligent doctors, just so that people in your position don't have to be afraid. And I just think that's beautiful. I love what you're doing. Don't ever stop, because what you're doing is amazing. And I know you're on to better, bigger things, because every time you talk, I learn something new, and you're inspiring, inspirational, and I love everything you do. Profiteers out there, we love you too. If you or someone you know, I imagine even in Canada, are suffering from any of these diseases, contact the LS Society through those links that she talked about, and see if you can get some help. And know that you're not alone. There's a whole community. And when you have a community, you can accomplish anything. Thank you so much for coming on, Elissa. We're going to put you up in the spotlight here. If you have a message for families, friends, or people who are suffering from the disease, or just want to inspire someone out there, we'd love to hear it right now.
Okay.
For me, let's heal our minds, bodies, and souls together.
I do want to point out that Canada has their own Leukemia and Lymphoma Society. So it's the Leukemia and Lymphoma Society of Canada, I believe. And
every time she talks, we learn something new. I just want to put it out there.
So there is a Canada. We have a Canada partnership up there. We love them. And but really, I think that we just talked about this on the podcast, this last one we recorded, and just to know that you're not alone. It's hard to go through. It's hard to go through cancer, and it's hard to see your family go through cancer. And just know that the Leukemia and Lymphoma Society is here to help you. The patient is really at the center of all we do. That's what we want to do every day. That's what we strive to do every day. We have passionate people working here, and we really want to help you get through cancer easier, and hopefully, improve your quality of life, make you help you advocate for yourself, empower you to advocate for yourself, and to get through this. But always know that you are not alone.
Thank you so much.
Inspiration.